talk a little about prostate cancer, give you some references and information that you need to share with anyone above 40 years old for sure, men, of course. But it's interesting to me that PSA can not only be checked and detected in men, but it can also be detected in females. And women who actually have high PSA in breast tumors actually have a better survival and less risk of metastatic disease, less severe disease. It's not specific only to men with cancer. This comes from anti-angiogenic activity of prostate-specific antigens to the PSA. PSA is not prostate-specific, having been detected in breast, lung, and uterine cancers. It is in one study, patients whose breast tumors had higher levels of PSA had better prognosis than patients whose tumors had lower PSA. So I'm here to tell you right now, I'm going to be discussing this topic because this is whatever they call it, Movember, where you need to shave or grow a beard and grow a mustache. I left mine just because I'm not going to do anything different than I normally do. And this cold winter coming up, I definitely want my beard to be able to shield me from the frigid cold winds of Tennessee. So we're going to be talking about prostate cancer. The first thing that I want to do with this segment of the show is I want to talk about the harms of PSA. And the only reason I'm going to do that, the only reason I'm going to kind of hammer that for just a bit, is if I don't tear down an idol, which many of us may say that we worship doctors, we say, I mean, just another patient of mine today, he's been doing phenomenal, he's getting off of medications, he's doing well under my care, and he's retired now, and he's talking about how now that he's retired, he's busier than ever, and he's actually driving friends of his to the VA hospital down in Nashville, so he's going from Clarksville down to Nashville, and he's driving all these people, and people are asking him to drive them to their doctor's appointments now. Mind you, he's under my care. He's healthy enough to be able to drive people to their doctor's appointments for which they're not healthy enough to drive down there for. This is my plead with people. If my patients are the ones healthy enough to drive other patients to their doctor's appointments and they have to use my patients to help others get to their other doctors, then they're going to the wrong doctor. And we specifically talked about a man, his friend, who is being given injections for prostate cancer. And I literally looked at him today. This was less than an hour ago. I looked at him, looked at my patient Jeff, and I said, Jeff, you've got to get that man into me. You've got to get him in here, and I need to sit down with him. You have to say to him, the next time you go, you're supposed to pick him up to drive him to Nashville, to his doctor's appointments. You need to say to him, we need to take a detour, and I need you to come and talk to my chiropractor. I need you to talk to my doctor who has information that may save your life. Folks, if we don't, again, tear down this idol, we believe, and this what the patient Jeff said. He's like, Doc, you have to understand, though, so many of these people, you know, they grew up rural, and it's just what the doctor says goes. This is all they're gonna do. So he's like, it's very difficult. I tell people all the time about your care and how good, such good work you've done for me, how much better I feel, how much healthier I am, but people just don't listen. They just keep going to their doctors. So if we don't destroy that for a minute, then the reality is, no matter who watches this, no matter who you are out there, you're going to sit there and say, you know what, that's really cool evidence that a plant-based diet and that nutrition could, in that one study, which I'll go through at the end of this video, could reverse prostate cancer. But you know what? I bet my doctor, my oncologist, my cancer specialist, my urologist, he's going to know what's best. He's going to tell me what's the best possible treatment strategy for me, and he's going to give me that. You're going to disregard what I say. You're not going to listen to me. You're going to move on. So I want you to bear with me very briefly to look at some of the things said by other medical physicians, and in fact, the founder of the PSA, the man who discovered the PSA test, folks. The discoverer of the PSA test said this: prostate test, public health discover. I never dreamed that my discovery 4 decades ago would lead to such a profit-driven public health disaster. This is Dr. Richard Ablin of the University of Arizona. He literally discovered the PSA check. And he said, it is a hugely expensive public health disaster, he says. The man who discovered the test even says and realizes that continuing to test it and only utilize the current treatments, chemotherapy, radiation, surgery, androgen deprivation, so the hormone drugs that lower your prostate cancer or prostate specific antigen or your testosterone, they lead to more harmful effects and disease processes like diabetes and strokes and heart attacks and impotence and intestinal perforations that then cause systemic inflammation and infection in a person's body, sepsis, and then they die from a result of the check or the treatment. He even says it. So if the man who discovered that test, far smarter than me, says it's a huge public disaster for men to continue to have their PSA checked and then go through the standard treatments, that's him saying it. One of the first books that I give people that are ever diagnosed with high PSA, I tell them, you need to read this book right here. How We Do Harm, A Doctor Breaks Ranks About Being Sick in America. This is written by Otis, Webb, Brawley M.D. Let's look at who Otis Webb Brawley really is. Who's he to write a book about doctors breaking ranks, about how the medical system in the United States is causing massive harm, specifically related to prostate cancer? Otis Webb Brawley, M.D., is the Chief Medical and Scientific Officer and the Executive Vice President of the American Cancer Society. What? Wait till you hear the words that come out of this man's mouth that are published in his book right here in front of me. Dr. Brawley currently serves as a professor of hematology, oncology, medicine, and epidemiology at the Emory University, and he also is a CNN medical consultant. Folks, very intelligent man. Let's look at what he says about this. He says this, because the reality is hormone drugs hurt your heart. And in this study here that I'm going to show you, and these articles that I'm referencing are going to be posted on my website with links and titles to them underneath the video when we have it posted there in a week or two. So hormone drugs for prostate cancer may hurt the heart. And in fact, they can raise cholesterol, worsen blood sugar, and make men fatter and thus likely raise their heart disease and heart attack risk. And in fact, now they're showing that it does. This was all the way back in what year? Did I even put the year on it? Didn't save the year. So some of these things are just from my data bank information that I saved to give people information. But they're literally saying that these hormone drugs cause men to die of diabetes, stroke, and heart attacks sooner than if they would have done nothing for their prostate cancer. And they would have lived longer. Dr. Brawley, in this book, again, How We Do Harm, says, to understand the magnitude of the societal experiment, the experiment is giving men radiation, chemotherapy, hormone deprivation drugs, the current medical standard of treatment for prostate cancer or high PSA. Those standard treatments, he says, are a societal experiment. Consider another point of information. Deaths from prostate cancer have been dropping every year over the past 2 decades, and this drop has added up to about 30% since 1990. So should we all celebrate because less men are dying from, and I emphasize from, prostate cancer? Should we all celebrate? No. Because more men have been taken from this world earlier than they would have been had they allowed their cancer to even simply run its course. It would have been better for the medical community not to have touched those men than treated them for their cancer. Folks, is all-cause specific mortality dropping because doctors are finding earlier stage disease and treating it effectively? He says that would be the best case scenario. But he says, the worst case scenario is at least equally compelling. Widespread use of hormonal agents is causing men to die of cardiovascular disease and diabetes before they would ordinarily die of prostate cancer. He says, that is what I suspect is taking place. So the only reason we have seen a decline in the number of men, up to a 30% decline in prostate cancer, is simply because men are dying sooner. More men are dying sooner. And if you look at the New England Journal of Medicine reference study that I talked about in a previous video, if you go on YouTube, look at the videos that I've put out there in the past, trying to do more and more about cancer here and get a lot of the information that I have saved and I've read through out there to the public. But the reality is, the New England Journal of Medicine found that men who had their PSA checked were dying at higher rates. More men were dying of prostate cancer if they got their prostate specific antigen checked. It's a simple blood test. Granted, there's risk of infection, transmission if you're having a needle stuck in you because of poor practices at a hospital or a doctor's office, but the reality is it's close to a very harmless test. The test could be phenomenal in its benefit if doctors would refuse to continue to practice dogma and believe that burning your cells and killing your prostate and your cells, even cancer cells are your cells. They're your healthy cells gone awry. They're malfunctioning, not working properly. They're not functioning the way they were designed, and they're growing exponentially. They're growing too fast, which may be actually relatively slow. They're not dying, and they're growing more. But it could grow so slow that it would never negatively impact your life. But doctors practice dogma and believe they've got to kill every cell that looks like cancer in your body, so they burn it with radiation, or they poison you with chemotherapy, or they cut out your prostate, which leads to impotence, doesn't prevent you from having metastatic cancer, which you'll get to that information from the research. Everything that I say is backed by peer-reviewed medical literature and research. I've got Dr. Brawley supporting my viewpoints in his book. Folks, I rant on this stuff. Why? Because fathers and grandfathers are dying as a result of medical intervention in what I feel should be medical malpractice if these men are not told that there is no way that you're going to live longer unless you do the right things for your health and your body. Because right now, more men are dying from prostate cancer and heart disease and diabetes and strokes, and in fact suicide, because of the significant mental side effects of those drugs and those treatments. I mean, I guarantee I know there's probably plenty of men out there that would commit suicide if they can never make love to their wife again. But that's a serious side effect of these drugs and these procedures. It's medical malpractice. If these doctors are not telling their patients, now if you can't urinate because your cancer swelled so bad that you can't urinate anymore, you got to have something intervention done medically, surgically, quickly, all right? I'm not saying never have some form of intervention, but because we're intervening in men that are basically living with cancers that if they did nothing, they would still live longer than doing something medical. So the aggregate harm is far greater because we're intervening when we shouldn't, and we're not telling men what they should be doing to get their bodies functioning and healing and reversing the cancer naturally so as to avoid all medical treatment and ultimately have side effects of increased sex drive, better erection, less fatigue, better night's sleep after you've had sex with your wife. And then what else? More energy, better quality of life, less heart disease, less stroke risk. The list could go on and on and on. Those are the side effects of the treatment that I'm promoting. Would you rather have side effects of impotency, illness and infection, fatigue, worsening sleep, growing breasts, what else? You know, you just think about all these side effects that they put these men through when they could literally sit there and say, hey, this study, you should go check out the Wild Doc on YouTube, because you know what? He rants and raves about plant-based diet, getting adjusted, and doing the right things. You check him out before you choose any of our burn or poison or cut. So, intensive lifestyle changes may affect the progression of prostate cancer. This is the American Urological Association. This comes from the Journal of Urology, 2005. So since 2005, we've been sitting on a study that men were reversing prostate cancer, living longer, having better quality of life, if they ate a plant-based diet. Granted, one good thing they say that has come about since about 2010 is less men are getting any treatment. About 40% less men are getting what is called active surveillance. And now studies are saying that active surveillance, just actively, you pay your doctor to watch you do nothing. And as you pay your doctor to watch you do nothing, that they're actually seeing less men die of prostate cancer. Quite interesting, isn't it? That we literally pay medical physicians to watch us do nothing. Folks, Dr. Brawley says this. He says that he had the opportunity to sit down with a marketer, an individual coming in to market prostate specific antigen tests to his hospital. This guy basically runs a hospital, Dr. Brawley does, and he's having somebody come in and market the use of PSA, which those marketers are funded by Depends Diapers. Ironic, isn't it? That's quite interesting that Depends Diapers wants more men to have their PSA checked. Why? Because guess what? A major side effect of the standard medical treatment for prostate: incontinence. Can't hold your bladder, you leak. So Depends Diapers sends their marketer in to get Otis Webb Brawley, Dr. Brawley, to push for PSA checks in his community. He says, though, Dr. Brawley says, as I struggle to control my anger, this gentleman explained the business for me. I love the fact that Dr. Brawley would actually get angry with the fact that somebody is trying to get more men free PSA checks. This marketer is trying to convince Dr. Brawley of doing more free PSA checks, free PSA checks in his community. I see the buses at our health department here in my community. I am disgusted and I'm angered that we're sitting there taking advantage of people in my community at our local, supposedly, health department that's supposed to be doing right for people. Did every man get the opportunity to have the discussion with those medical physicians, nurses, doctors, whoever's doing that blood test? Did they have an opportunity every November to be told, this test actually increases your risk of dying if you only follow your medical physician's advice? If they're those, which sadly it seems like the majority, because there are a few medical physicians that know about the plant-based diet, that know about active surveillance and doing nothing is better than actually actively treating it, and would give men the opportunity to make an educated decision on not doing standard medical treatments. But it seems like most are pill pushers. They sit there and say, hey, you got cancer, you're high PSA, you got to get treatment right now, it's cancer, hey, you're going to die, it's cancer. They literally yell it. Well, I was scared, it was cancer. Meanwhile, they're not telling the men that, yeah, you have cancer, but what we do actually is more harmful than your cancer. That's what they should be saying. So I love the fact that Dr. Brawley gets angry, because I get kind of fired up too. Hey guys, I appreciate everybody being online. So hang in there with me, I'll get to you guys with questions. So first, free screening, he says. So this is the salesman talking, quote, first, free screening provides free good publicity for the health system. Publicity, hey, we got free PSA checks here at the health department. Come on down, get your PSA checked. Let's prevent prostate cancer. Just like we did in October preventing breast cancer, which we didn't actually prevent it, we promoted breast cancer with mammograms. Again, go back and watch the videos on mammography and realize that more women are developing breast cancer and dying of breast cancer because of mammography screening, because it's radiation which causes cancer. First, free screenings provide free, good publicity for the health system. People really feel good about us because this is a community service. It will cause women to come to our women's center and men to come to our chest pain center. It increases almost all of our product lines. It's cheap, effective advertising. What's the medical system seem to be about? Is it about saving lives or is it about the money? There are so many ironies in that one small paragraph. I can only shake my head. The problem with our medical community is because all these programs, they got front groups. Most of these nonprofits are nothing more than being given money from the pharmaceutical industry to go and promote the products that the pharmaceutical industry sells. So even though they're technically nonprofits, they are nothing more than a business set up so that the pharmaceutical industry donates money to them while they're nothing more than their advertising campaign with a front that looks like a caring, heartwarming organization that just wants to see less men die of prostate cancer. For every 1,000 men, he says, over the age of 50 who volunteer for free screenings, 145 will have an abnormal screen for every 1,000. Okay? Given the demography of the mall, 10 of the 145 will have insurance that our health system doesn't take. So 135 will come to see us for the abnormal screens. We make up the cost of offering free screening by charging for the evaluation of the abnormal screen. About 40 to 45 will have cancer. We hit bingo with them, he says. That's his words out of that man's mouth, according to Dr. Brawley. They hit bingo. You know what? You know when my grandma plays bingo? She only yells bingo and says bingo when she's excited about something. Do you like that people offering free screening, like this man right here, says they hit bingo because you have cancer? What I also think about is if 145 had abnormal tests, potentially saying that they had severe disease, cancer, right? The man says, we'll just disregard 10 of them because they won't come in because they don't have insurance that our healthcare system takes. So, we'll just disregard them. We'll let them go on their way. We won't try and contact them. We won't try and help them. If it was severe disease, I think the human nature would be go out, reach out to those men, and do whatever it takes to try and help them. That's a principle that I stand on. We know the number who will get radical prostatectomy. We know the number who will get, that would be cutting out your prostate. We know the number who will get radiation therapy, and we know the number who will get hormones. We know the number who will have incontinence because of those procedures. So bad that they will want an artificial urethral sphincter implanted so that it closes the holes up so that you don't go to the bathroom when you don't want to. We even know the number who will not be able to get erections and will want Viagra, so we know we'll sell more drugs. I'm throwing in a couple extra comments here if you guys don't realize that, just so you guys know that we sell more drugs was not actually in the book. But that's what he meant. We know for how many Viagra won't work, will not work. We know how many penile prosthesis we will sell. I'm sorry, but literally I'm thinking to myself, okay, yes, till death do we part, and if somebody can't get an erection, but I would be so ticked. I understand that me revealing this type of information has got to literally piss somebody off. It pisses me off the fact that doctors are still not telling people the truth. If they haven't told you the truth and you have succumbed to those side effects and no longer be able to make love to your wife the way God intended you to, instead you've got to use a penile prosthesis. My heart breaks for you. It's for men that have not succumbed to those side effects yet that I'm trying to reach. And the ones that have already been harmed by the medical community, my heart breaks for you, and I'm sorry I didn't get this information to you sooner. So what I want to ask everybody online right now is share this right now. Share the truth. Don't just like it, because that's the only way we're going to save lives. That's the only way we could possibly save relationships and marriages possibly. Realizing, this is Dr. Brawley in his book, Thinking, realizing that I've been granted an audience with Lucifer, I asked the fundamental question: how many lives will be saved if you screen 1,000 men? The marketer took his glasses off, looked at me as if I were a fool, and quote said, "Don't you know? No one knows if this stuff saves lives. I can't give you a number on that." Folks, if a marketer for PSA screening, a marketer trying to sell hospitals, buses driving around my community checking PSA, if they literally cannot give the number of men that would be saved because of that test, then they better be telling men that before they give them the test. And they better be communicating to them that what we do know is we know how many men are going to need penile prosthesis, never being able to make love to their wives again. We know how many men will need Viagra to be able to do that. We know how many men will die as a result of systemic infection. We know how many men will die of other cancers because of these procedures. Radiation and chemotherapy causes cancer, folks. Then to me, that's a criminal. If they're not giving that information to the public before they do these free screenings, and this man knows what he is doing will lead to harm. He knows it will lead to harm, but he can't give a number for how many will have their lives extended. I don't have evidence for benefit, but I do have evidence that I'll sell a lot of Viagra and Depends diapers. If you have evidence that you're going to cause harm and you don't have evidence that you're going to help anyone, then you're a criminal when you do that. You deserve jail time. Folks, it frustrates me because this is taking advantage of people because they just don't know. Hey everybody, I'm the Wild Doc, and if you enjoyed this video, make sure that you hop on over to thewilddoc.com. Subscribe there for our newsletter and email campaign. Join in the conversation on Facebook, and let's transform the world by unleashing the power of natural healing.